Interpreting acid-base balance refers to analyzing and understanding the levels of acids and bases in the body. The balance between acids and bases in the body is crucial for the proper functioning of various physiological processes. The body regulates pH through the actions of the respiratory and renal systems. The respiratory system regulates CO2 levels by adjusting the rate and depth of breathing. The renal system regulates HCO3 levels by excreting or retaining bicarbonate in the urine. To interpret the acid-base balance, healthcare professionals rely on arterial blood gas, ABG, analysis, which measures the levels of arterial blood pH, carbon dioxide, CO2, bicarbonate, HCO3, and oxygen, O2. The results of the ABG analysis are typically reported as follows. 1. pH. The pH measures the acidity or alkalinity of the blood. The normal pH of arterial blood is between 7.35 and 7.45. If the pH is below 7.35, the blood is considered acidic, and if it is above 7.45, the blood is considered alkaline. A pH of less than 7.2 or greater than 7.6 is considered life-threatening. 2. CO2. The CO2 measures the partial pressure of carbon dioxide in the blood. The normal CO2 range is 35 to 45 mm of mercury, with values above 45 mm of mercury indicating respiratory acidosis and values below 35 mm of mercury indicating respiratory alkalosis. 3. HCO3. The HCO3 measures the bicarbonate levels in the blood, which helps to regulate the pH. The normal HCO3 range is 22 to 26 MEq/L, with values above 26 MEq/L indicating metabolic alkalosis and values below 22 MEq/L indicating metabolic acidosis. Based on these results, healthcare professionals can determine whether the patient has an acid-base imbalance and what type of imbalance it is. Respiratory acidosis. This occurs when the lungs cannot eliminate enough CO2, leading to an increase in blood acidity. Causes include conditions that affect breathing, such as chronic obstructive pulmonary disease, COPD, or severe asthma. Respiratory alkalosis. This occurs when the lungs eliminate too much CO2, leading to a decrease in blood acidity. Causes include hyperventilation, anxiety, or high altitude. Metabolic acidosis. This occurs when there is an excess of acid or a decrease in bicarbonate levels in the blood. Causes include kidney failure, diabetes, lactic acidosis, and severe diarrhea. Metabolic alkalosis. This occurs when there is an excess of bicarbonate in the blood. Causes include vomiting, excessive use of antacids, or kidney disease. The interpretation of acid-base balance involves determining the underlying cause of the acid-base imbalance and treating it accordingly. For example, if a patient has respiratory acidosis due to hypoventilation, the treatment may involve improving ventilation or using mechanical ventilation. If a patient has metabolic acidosis due to renal failure, the treatment may involve correcting the underlying cause of the renal failure and administering bicarbonate. In conclusion, interpreting acid-base balance involves analyzing the pH of the blood and the levels of CO2 and HCO3 in the blood. Understanding acid-base balance is essential for healthcare professionals to diagnose and treat acid-base imbalances, optimize patient care, and improve patient outcomes.